Hello everyone, I am Dr. Rushi, Professor and Head, Department of Clinical Psychology, All India Institute of Speech and Hearing, Mysuru. In the previous videos, you have learned how the possible risk factor in the early milestone can be helpful in the identification of autism spectrum disorder, and what are the common myths and facts and FAQs about autism spectrum disorder. So in this video, we will be focusing on supporting the individual with autism spectrum disorder and their families from diagnosis to intervention. As we know that 1 in 68 children in India are diagnosed cases of autism spectrum disorder. And let me tell you that this figure is also underreported because there is 80% of treatment gap in our country. Like 80% of the people, they don't go forward for their treatment, they have poor help seeking behavior. More than 80% of the children with autism spectrum disorder, they manifest their symptom before the age of 24 months, but it is sometimes difficult for the parents to identify those symptoms. But let me tell you that it is very easy to identify. You just have to remember that it is not the presence of any abnormal behavior in the child. Rather, it is the absence of a normal behavior in the child where you can consider that symptom as a red flag sign. For example, no response to name calling even when the child is having no hearing impairment, no facial expression or expression of any emotion, or there may be absence of any imaginative play or absence of any imitation behavior. There are two main areas where the child may have difficulty. One is the persistent deficits in social communication and social interaction. Another is the restrictive, repetitive and inflexible patterns of behavior, interest and activities. The onset is usually during the early period of the developmental period. And all these symptoms should impact the various aspects of a child functioning. Presentation of autism varies from child to child based on the environmental stimulation. That's why the parental engagement with the child is very crucial. Have you heard the term double empathy problem? Because we know that it is bidirectional in nature, where both the parties, they may have problem in understanding each other. They may have difficulty while understanding the emotions of each other, understanding the thoughts, behavior and perceptions of each other. Persons with autism, they see the world differently because their focus and their attention will be very restricted. You will see that they feel the world differently because they have different reactions to the sensory stimuli. They process the world differently because their way of thinking patterns, their way of information processing is somewhat different from us. Because they are not able to process the information like us, they are bombarded with so many stimuli, and sometimes that is the reason that the anxiety takes place. They are having many psychiatric and physical comorbidities as well. Depression and anxiety is very common in about 10 to 20% of children. They are diagnosed as depression and anxiety. Apart from that, gastrointestinal problems, sleep disorders, ADHD, OCD, these are the other very common conditions. Around 35 to 50% of the cases have intellectual disability as well. Clinical diagnosis is based on the standardized diagnostic criteria of 11th edition of International Classification of Diseases, the developmental history of a child, his social interactions, observation during the clinical interview, and there are some standardized test assessment tools with the help of which we can identify the autism spectrum disorder. Hearing test is required in children with social and communication difficulty. Let's discuss about the impact of autism on the child. In the childhood, they struggle to be as a part of the mainstream schooling. Many of the time they have difficulty in getting the admission in the mainstream school, and even if they get the admission, they are being bullied, discriminated, stigmatized and isolated, which eventually leads to social isolation and school dropout. And because of the school dropout, because of our inability to teach them, because of our inability to incorporate them into our society and into our education system, they are unemployed. They are not able to complete their education. They have no partner in life. Because these children have problems in social communication, many times parents do not spend adequate time with these children as compared to other children. That is also one of the reasons for their social isolation, and they feel neglected in the family, even by the parents. Many times it is not only the child, the whole family suffers. Let's discuss the impact of autism on the family. Often parents have guilt of giving a birth to a child with autism, and many times they may have financial difficulties, financial crisis in the family, because a lot of resources are required for the therapies or for the treatment of the child. So many times they have to change their expectation from the child. They have to make compromises with their dreams, with their aspirations. Many of the times we see that the reason for a family discord or divorce in the family is because of the child with autism spectrum disorder in the family. So, understanding the child with autism and to cope up with the child and to cope up with their meltdowns is a very big challenge for the parents and the caregivers. Many times, parents waste their time in doctor shopping to find the cure for their child. Many times, they have to change the residence so frequently because the owner of the house is not comfortable while giving the home on rent. So it is a full-time job, 24/7 they are engaged with the child. They face stigma and discrimination from the society, sometimes from their own relative, and that can also lead to social isolation for the family. Sometimes the siblings also feel neglected because the parents are giving most of their time to the child with autism. So it is not only the child, it is not only the family, the whole community is also getting affected. So it is our responsibility, it is very important to educate the whole society to make it more inclusive. Coming to the treatment of autism starts with the complete thorough evaluation of the child. Once the diagnosis is made, we need to educate the parents. It is very important to break the myths which has been discussed in the previous video. Engagement of the parents in the process of rehabilitation is very crucial. It is very important to rule out and treat the comorbidities like epilepsy, depression, anxiety, psychosis, and so on. It is also very important for the families not to fall into the trap of non-scientific autism cure advertisement. The resources of the families are drained out in search of appropriate treatment to cure autism. There is no cure for autism, but with appropriate interventions and support, individuals with autism spectrum disorder can learn to manage their challenges and learn valuable skills. So objective is to maximize the functionality and quality of life. Treatment starts with multidisciplinary team. Management is always individualized, but that it may change over the time. There are a range of interventions for the management of autism spectrum disorder. Based on the level of functionality and deficits, treatment can be chosen. Applied behavior analysis is one of the common evidence-based treatment. This approach used to teach the progressive changes in an individual for cognitive, communication, self-care, and even employment support. Speech and language therapy is also commonly used which can have range of communication methods. In some cases, physiotherapy and occupational therapy is also used for the deficits in motor functions, planning, and sensory processing. Daily life therapy is also commonly used therapy, which emphasizes the holistic approach while focusing on three fundamental pillars: physical stamina building, emotional stability, and intellectual stimulation. Pharmacotherapy is used not for the core features of autism spectrum disorder. In some of the cases where behavioral intervention does not work, we can use some antipsychotic for the symptoms of hyperactivity, sleep disturbances, and violent act. So medications like risperidone, aripiprazole may be useful in those conditions which have been prescribed by the psychiatrist. So parental education and awareness is the key in the management of autism spectrum disorder. All India Institute of Speech and Hearing is trying to impart that not only through the multidisciplinary team which is working in the autism spectrum disorder unit, but also by conducting various workshops, not only for the parents, but also for the teachers, for empowering and educating them about the early identification of autism spectrum disorder and management of social, behavioral, and communication concerns. So, let's promote inclusivity, accept and celebrate the diversity. Let's understand our role as a parent, as a teacher, as a society to create more compassionate society where all the individuals with autism spectrum disorder can thrive. Thank you.